Right, so good afternoon, Healthy Way Challengers. I'm seeing a lot of activity on the Facebook group and I'm absolutely loving it. I must say, you guys are inspirational. I'm just loving the energy. I'm loving the commitment, and I'm really loving the accountability amongst everyone. So I really do encourage you to keep the posts coming. Let us know what you're doing. Let us know what you're eating, what exercise you're doing, what you're doing for self-care. And of course, any questions that you do have. So really, really enjoying the interaction on the Facebook group. And like we said last week, we are going to be doing some spot prizes. So we literally put all your names into a hat. So if you've posted a couple of times, you would have had a couple of names in the hat. And we have drawn 2 of those names, which we will announce at the end of the session. So every week we're going to be doing that. Okay, so today we're giving away 2 Total Sports vouchers to the value of 500 Rand each. So if you did post during the course of the week, it could be your name, but you'll have to wait until the end of the session to see if it is. But for now, we're going to get straight into it, and I'm going to welcome Steve. I'm going to actually hand over to Warren to introduce him and give him a nice official welcome. But from my side, thank you for being with us today, Steve. And Warren, over to you to introduce Steve.
Okay, thanks everybody. Thanks Cheryl for that introduction. So PPS Healthy Way Challenges. As Cheryl said, it's just been so fantastic to see the amount of activity that's starting to happen on the Facebook page. And I know that some of you are only going to watch this link a little bit later. There's 120 of us on the page. So let's get a lot more activity going. Let's start posting. Let's get that sense of community going. Let's really rock and roll this thing. And of course, I'm going to be throwing in a whole lot of six-pack philosophy along the way. And so really looking forward to that. So just quickly to introduce Stephen Murray. Stephen Murray has been our consulting exercise physiologist on last year's Healthy Way Challenge. And then, of course, again this year. Now, Stephen has been in the health and wellness industry for at least 3 decades. And now at 35, Steve, you were 5 years when you started. So, man, that's an early start for you. But so I'm just kidding. Steve, as I say, he's an exercise physiologist. Been in the industry for 3 decades, all the way back. I remember Steve speaking to me years ago about being the strength and conditioning coach for an American football team called the Green Bay Packers. So right through from international experience, right through to athletes, to everyday people, and now specifically working with and through the health architect. So I'd just like to say, Steve, thank you so much for joining us today. And if you haven't watched Steve's introductory video, it's really worthwhile to have a watch. So I'm exceptionally happy to have you with us today, Steve, and really look forward to your presentation. So over to you, all yours. Steve, you're on mute.
All righty, thank you so much, everybody. Right, so Warren asked me, can everyone see this? Is this all right? Can you see it?
Yeah, we can see that, Steve. That's perfect.
All righty, okay, good stuff. Okay, so thank you very much, everybody. It's a great privilege to spend some time with you today. And also just to check, Warren, the timing is, just give me the amount of time for this presentation quickly.
You've got from now till 1:45, Steve. So you've got roughly 35 minutes, and then there's going to be some time for Q&A.
All right, great. So Warren asked me to chat a little bit about a real passion of mine, which is physical activity. And I really wanted to head this up. Are you fit to live, and what's your number? And we'll get to that in a little bit. But I want to start off maybe by asking a question and framing this maybe in a slightly different way. So have a look at this. If I told you I had a drug that if it was taken as prescribed, and that's important, would you take it? And this drug did the following. It reduced your chance of dying if you have existing heart disease, reduces your chance of dying by 45%. It reduces your chance of developing cardiovascular disease by 30%. It reduces your chance of dying from 13 different kinds of cancers by 30%. It completely reverses prediabetes or metabolic syndrome in 88% of patients. It reduces the risk of dying from the complications of diabetes by 66%, irrespective of age or weight. You're obese even if your weight doesn't change. And so is there anyone out there that would kind of go, yeah, could do better? So if we put that into drug terms, would you take it? So, but this isn't news, you know. I've been doing this for so long and presenting this stuff for so long that sometimes I'm a little bit jaded. Not Jada. Didn't say anything about Jada. I think it's sorry. No dog in that fight. But just jaded a little bit because this is not news. You know, this guy on the right-hand side, Hippocrates. You know, he's quite an old guy. He's been around for a while. He said that walking is man's best medicine, and he said also our food should be our medicine. Our medicine should be our food. So this, we're not talking about stuff that's come out of the woodwork all of a sudden. In fact, Bob Salas, who was the chairman of the American Medical Association, said if it was a pill, if exercise could be put into a pill, it would be $1 trillion moneymaker and would be prescribed by doctors to everybody. So I really want to take, if I can, 5 minutes to run through the literature. And this is the last kind of research graphs you're going to see. This is Stephen Blair's work, and this was published in 2009, and it's pretty much the seminal work that we look at when looking at physical activity as a genuine game changer. So here's the one. The graph basically talks about attributable fractions, which is a fancy word for the number of deaths in a population. And I've tried to summarize it. So the bottom line here is you can be diabetic, you can have high cholesterol, smoke, and be obese. And you're going to die less. You're going to die. Your chance of dying is less than your colleague who has got low fitness. So just to say that again, the person with low fitness is going to die before the diabetic with high cholesterol who smokes and is overweight. And I mean, for me, that's a hello. You know, what are we missing here? So let's just look at another one quickly. So age is just a number. Fit 80-year-old is going to outlive the unfit 60-year-old. That's the simple truth of this graph here. And how's this one? So CRF, when you see CRF, I talk about cardiorespiratory fitness. So CRF refers to cardiorespiratory fitness. So if you're fit, it improves your mortality even if you have risk factors. So in other words, if you are overweight, if you smoke, if you're diabetic, if you've got chronic obstructive pulmonary disease, or if you have hypertension, if you are fit, you survive longer. So it reduces mortality simply by being fitter. And here's one that's quite topical, but really, really important. So big studies coming out now, really big meta studies looking at large numbers of patients. We see that in a COVID-19 reality world, physical activity is a stronger predictive of death, physical inactivity, than heart disease, cancer, diabetes, hypertension, smoking, and obesity. So all of you would have heard about comorbidities. That's, you know, one of the words that we kind of all of a sudden was new. When we started to talk about COVID-19. I spoke to a colleague of mine recently who did work up in Northern California during the height of the COVID pandemic up there. And what they were doing was triaging patients outside of the hospital. So if you came to the hospital and you had a high fasting glucose, you had a waist circumference of greater than 102, I'm talking about a male. If you had high HbA1c, for example, that's a glucose mark in the blood. If you had high LDL, which is another cholesterol, you had high triglycerides. What they would do is just triage you there, give you a bed downstairs, but you were not going to get up to an ICU bed. So your chance of death was greater than 50% from when you were admitted, if you have those risk factors, and that's in that little group at the bottom there. So what we're saying is that being physically inactive is a greater predictor of dying than all of those put together. So that's topical for us right now in the world we live in. So when I said another thing, very few good things coming out of COVID. But for us and in the world, in the work I do, when we talk about flattening a curve, it suddenly people start to hear that and starts to make sense to people. So let me ask this question. If 111,791 people died every day from COVID-19, if that happened, what would our society response have been? What would we have done if that was the case? And that's the scary part. And when I spoke a little bit on that video that we did, I said human beings are like frogs. But I think I'm being a bit harsh to frogs, because the simple issue here is that is the number of people, by the way, 111,791 that will die today from diseases that are A, preventable, completely preventable. Number 2 are treatable. And number 3, in a large number of cases, reversible. That makes no sense to me. That we are still like frogs. So the water's got a little bit warmer, and it's slowly boiling us to death. So that's the reality of non-communicable disease. That's the word we use. Diseases that are completely preventable and are lifestyle related. So despite our very best efforts, I've been doing this since 1994. And that was the first time that myself and my colleagues, we opened a cardiac rehabilitation facility at Mill Park Hospital in Johannesburg. No one listened to us. We were very enthusiastic. We were young, and we believed that we'd found a way to prevent disease. But so I've been doing this for a very long time, and I'm one of the group of people who would say, we've tried. Despite our best efforts, we failed. We have absolutely failed to control this growth, absolutely pandemic growth in chronic disease. So here's where I think it starts to come together. So that the answer was, I don't know if it was hiding in plain sight. I think it was much more hidden in plain sight. Not just my group, but scientists all over the world, probably less than 10 years ago, started to say, well, hold on a second. We're obviously doing something wrong here. So, and scientists, good ones in particular, have a real obsession with the word why. To me, I'm a how person that irritates me, because, why is the question I often don't want to get asked. But this was very important, because as a group, as scientists, as people working in preventative healthcare, we were not getting anywhere. And to be honest, we're still not getting anywhere. We're still not moving the needle significantly. But I think we're closer than ever before to understanding a little bit of the why. So this actually started, this whole school of thought around our ancient DNA and what we should be looking at really came from anthropologists working together with medical people, historians, because that's where the answer started to come together. And the question that we started to understand was that what does our ancient DNA expect from us? And what do we actually do? And in there lies maybe the key to understanding chronic disease. So I like to have conversations. I've got a vivid imagination. I think it's probably spending all that time in my room reading books as a kid, but I like to understand and have conversations with myself, because I think that starts to make sense for me. So the way I look at this is, and maybe it makes sense, I always ask my patients, do you have someone in your family that would fit this profile? Someone who cares about you deeply, but doesn't believe a word you say. I've certainly got some people like that. I had a boss like that, actually. And it was a woman, and she'd look right through me as I'm just talking the biggest load of nonsense. So if you think about your DNA as your benevolent aunt, your DNA, we used to think, and I think sometimes it's portrayed that way, DNA is simply gives you your color of your eyes or tells you how tall you're going to be, or etc. That is a minuscule part of what our DNA does. Apart from that, it is responsible for every single chemical reaction that happens in our body, millions and millions of them a second. It operates from well before you're born till the day that we die. And it essentially, your benevolent aunt is simply your DNA. And your DNA, I picture her, this very severe kind of woman with a massive code book. And that code book is 1.9 million years worth of collective experience. And that's just incredible. That gives us a starting point, that we know that we're going to, if this happens, then we do this. So she's got this massive code book with a big set of keys on, and walking around saying, hey, what do we need to do? Because that code is how we essentially operate. But we human beings we're essentially, we don't listen, So remember that 1.9 million years of evolution, because that's how old our DNA is, by the way. So we know that the last big version of humanity, we've certainly found DNA that's 1.9 million years old. So this is what she expects. Oh, quickly, by the way. More important, there's a school of thought, and it's a school that I happen to agree with, that between 35,000 years and 10,000 years ago was our golden age as human beings in terms of health. Obviously not in terms of technology and so on, but in terms of health. You're not going to convince me that we were hunters and gatherers. I mean, we were much more likely hunted and gatherers, but that's a talk for another day. But that time period, just before the kickoff of real agriculture, was where we were our healthiest, as a species. So that is what she is expecting, our benevolent aunt. That's what she expects us to do. And off that set of behaviors, she's pretty much got the answers as when things go pear-shaped in various ways. Because remember that her job, given to her by our Creator, is one. She has one job, and that is balance, homeostasis, balance, everything, every system in balance. So if you go back 35,000 years and you say, what did that look like? Well, this is what it looked like. From a physical activity perspective, we would have done about 350 minutes of moderate activity per day, and about 180 minutes a week of vigorous activity. So that's actually not that much. And that's why I say there's not a whole lot of hunting that we were doing there, but I don't want to digress there today. So physical activity, 350 minutes per day, 180 minutes per week. When it came to, and also, by the way, we pretty much did two things when we were stressed. We fight or we flee. And that's critically important when we look at other things like stress management and healthy coping. But that's our physical activity box. In the nutrition box, again, outside of the scope today, but still important, we had massive variety in our diets. We would eat about 100 different types of foods in a week. And those were very high quality foods. Today we eat between 3 and 10 and very low quality. You can have a look through those. If you want to share this presentation, I want to stay in the physical activity box. So that's what our DNA expects from us. The problem is we don't do that. So over the last 70 years, human beings have thrown that code book out of the window. And I spoke to a geneticist when we were building up this theory a while ago. I said, if you had to put all of human evolution into a year, 365 days, what would 70 years be in terms of unit of time? He said, you couldn't get a unit of time that small. So remember that chronic disease is not old. It is 70 years old. We only started to see chronic disease in the 1950s. So if you go back and say, well, what are we doing to create this? Well, this is what we're doing. So from a physical activity point of view, we're doing less than 150 minutes of moderate activity per week. That means we've got reduced insulin sensitivity and a whole bunch of other stuff that goes really awry. And if you look at this diagram, you'll see the arrows just going bang, bang, bang. That's inflammation, chronic inflammation. And we know, this was Time magazine, by the way, 1996. So this was the cover of Time magazine then, which was already stating we knew that chronic systemic inflammation was at the heart of what we now call chronic disease back in 2004. So chronic disease starts with inflammation, but there they are. Cardiovascular disease, osteoporosis, your chronic inflammatory diseases like rheumatoid arthritis, your neurological disorders like Alzheimer's and dementia, your diabetic issues, your metabolic syndromes, your obesities, and cancers. So that entire group of diseases comes from chronic inflammation, which is simply a lifestyle-related issue because we've changed our lifestyle so significantly in the last 70 years. So the real problem here is low movement syndrome. That's just a word we came up with. Low movement syndrome. And that's the new HIV. That is the existential threat that faces us as a species at the moment. You see, but here's the problem. Here's the problem. And this is where I've become less and less politically correct as I've got older, because this is where we started to make really bad decisions, and not only bad decisions, but I'd go as far as to call them as to say criminal decisions. Because could it be, the question is, could it be that we'd solved the wrong problem, but we'd solved it very well? I mean, that's kind of the issue. By the time we'd figured this out, we'd already blamed cholesterol for heart disease. Cholesterol is I feel sorry for cholesterol, spent a generation in prison for a crime it did not commit. But we'd already blamed it for heart disease. We'd already labeled cholesterol a disease. We'd already blamed fat for fat in your diet for obesity and for type 2 diabetes. We'd labeled them both as diseases. We'd labeled hypertension as a disease. And the reason why we'd done that is because if you label something a disease, you can develop a drug for it. And we had done that. And the problem is, to walk that back is a multi-billion-dollar exercise, and that was not going to happen. So this is where we started to get kept in the dark and essentially lied to for a long time. And unfortunately, it still happens today to an extent. So this is why I say what's important to understand from my perspective is that your doctor and your medical aid cannot supply you with healthcare. And whenever I say that, I always think, well, if this was medieval times and I was standing on a soapbox, I think I might have a bad day, because you don't want to get on the wrong side of very powerful lobby groups. But essentially, let's just look at this. So this old chestnut here, anybody who's ever been in this field has seen this diagram at some point in time, and it's called the wellness continuum. And essentially starts with that black arrow there in the middle, at some point neutral health, if you want to call it that. And if you go to the left-hand side, you talk about signs, symptoms, disability, premature death. And essentially, if you look at what I've said there, in order to identify signs, symptoms, and disability, you've got to be able to diagnose. If you're diagnosing, it means that you're asking two questions. What's wrong with you, and what am I going to do to fix it? So if you're thinking that our doctors, our medical professionals can help you with healthcare, we're asking the wrong person, because they are fundamentally involved in sick care and not in healthcare. If you want to go to the right-hand side, which is healthcare, that's about awareness, education, growth. Those are behaviors. They are not necessarily episodes. So the person who's responsible for our healthcare is very, very different from the person and the teams that are responsible for our sick care. Because if you're looking at healthcare, it's a different question. We're asking, why is something wrong? And how do I help you to fix it? Because that is a lifetime of behavior. that's going to make sure that we don't go the other way. So when we talk about being fit to live, and the question is, what's your number? It's actually not complicated at all. So if anybody wants to use physical activity as the way it should be, as the most potent drug on the planet to manage your health, this is how you do it. Also, exercise physiologists, we could also get things complicated sometimes, and we can measure things in like VO2 max and all this kind of stuff, milliliters of oxygen, and it just gets confusing. So what I really like is this little number method here. And it uses a measurement tool called a MET. Again, not really complicated to understand. If you are sitting down listening to me right now, you are exerting 1 MET of energy. What you need to be is at 10. And this is how it breaks. If you have a cardiorespiratory fitness of less than 5, you're in trouble. You are in trouble. The chronic disease that you have, if you have one, is going to kill you, and your chances of developing a chronic disease go up by greater than 60%. If you have a CRF fitness number of between 5 and 8, that's like going up an escalator the wrong way. You can do it, but at some point you're going to get spat off the back. So you're kind of in a holding pattern there. But you're certainly better than below 5, but it's still a risk, and you're still at risk. If you get to a CRF, a cardiorespiratory fitness number of 10 or more, that's where the magic happens. And that goes back to our benevolent art and what she expects and what we would have been doing. So your chances of developing a chronic disease drop by 60%, and the chronic disease that you have won't kill you, and that's really important. So, and now the question is, well, let's get to 20, let's get to 25. And this is the thing that confuses a lot of people and puts people off physical activity, because that's not true. This is not a linear relationship. So in other words, the more physical activity you do, you get better. That is not true. So after about 30 minutes a day, around about there, between 30 and an hour, there is no more benefit that you get. So after that, that becomes a sport. That becomes then something you want to do because you like the sport. But to be healthy, you certainly don't need to continue up that curve. It doesn't give you a linear relationship in terms of benefit. So it's quite a simple thing to look at, and remarkably simple to test and to see where you're at. So here's another thing about exercise. Only volume and intensity actually count. So, I see this all the time. This is the workout. These are the exercises done in this order at this time that produce the best benefit. That's just absolute rubbish. The bottom line is only volume and intensity counts. In other words, only how much and how hard matter. So how you do that, whether it's climbing mountains, whether you like to walk with your dog, whether you want to dance in your naked in your living room, it doesn't matter. That the mode of exercise is irrelevant. How much and how hard is important. So how much? Well, between 150 and 300 minutes of moderate, or 75 to 120 minutes of vigorous activity per week is what you need. That's it. Nothing more. And so that's the how much part. The how hard part, again, we can overcomplicate things. We need heart rate monitors or expensive watches or whatever. Not true. There's loads of ways to measure exercise intensity, but moderate means that you, on a talk test, means that you can say, I like to use A to P. You can recite the alphabet from A to P, but you can't sing your favorite Beyonce song. I mean, that's how simple, exercise intensity can be. Yes, it's great. You've got a heart rate monitor. It will help. But intensity, moderate intensity between 65 and 75% of maximum heart rate typically would be considered as moderate. Above 75%, if you use the Discovery Vitality kind of method, they will start giving you points above 80% of maximum heart rate for at least 30 minutes. So exercise intensity is easy. Volume is very, very simple. 150 to 300 minutes of volume, and between 60 and 75% maximum heart rate. If you want to go higher than that, you can drop the volume down. And that's pretty much what we need to do. I want to touch on a couple of things that are really important, that I think have become really, really topical, certainly for us in our clinical practice where I am now, and certainly since lockdown and COVID. The number one is sitting, and to just highlight the fact that sitting is a disease. And again, there's a good evolutionary method. If you go back and you ask, well, what would our benevolent aunt have expected when it comes to sitting? There would have been two reasons why you sit 35,000 years ago. One, you're old, and two, you're sick. Those are the only two reasons why you sit. And if that happens, well, your benevolent aunt's got a code for that. She goes to code, says, old and sick, great. We need to help you die. Because what you don't want to be done, what don't want to do is sit under a tree for 20 years because your group leaves you behind, and you're going to have 20 years under the tree. So it's common sense. So what happens really in real terms is that your DNA wraps up, it starts to hide all of the genes that are there to protect you from chronic disease and illness, because it wants to help you die, because obviously that's what you want. So sitting is an absolutely vital thing for all of us to address. And this is how's this one? Really important to understand. You can, with a great piece of research done, exercise for 4 hours a day, sit for 8 hours a day. You get no benefit from the exercise that you did. So sitting on its own is an independent risk factor. So please, if I can say one thing to everybody, please don't sit for more than 50 minutes. That's what the data tells us. After about 50 minutes, you start to be in trouble. So we see lots and lots of backs and necks and so on from sitting. Yes, sitting is mechanically bad, but from a health perspective, it's way worse than the mechanical issues that you get from sitting. So sitting is something we really need to start addressing. The other thing that is important to understand is that exercise is not just for fit people or for healthy people. Exercise as a medicine, we can now prescribe as a drug. So if you have a look at these conditions, for example, if you so to achieve benefits, if you're healthy, I've already spoken through that. So 8.7 kilocalories per kilogram is basically the same measurement as I spoke about a little bit earlier. But if you go down and you look at heart disease, diabetes, depression, metabolic syndrome, colon or breast cancer, and the prevention of CVD, we can now prescribe exercise as accurately as per kilogram of the body weight per week. So in other words, exercise is a real drug. If you use it like it is prescribed, it has amazing benefits. If you take too much of it, it can be harmful. If you take too little, you'll miss the benefit that you want. So exercise is as good for sick people. If you have chronic disease, it's as good as for those people that are apparently healthy. So that's important too. So kind of the last thing I want to say before I sort of open up this up, if there are any questions, is that one of the biggest objections we get in our field is time. And I think Warren would agree with me. We hear that all the time. I don't have time. Well, if you don't make time to be physically active, well, you're going to make time to be ill for sure. So you've got a choice. Then I would like to certainly see physical activity being much more mainstream, than it is, obviously. But we still live in a world where there's a standard of care for hypertension, as an example. The standard of care, if you have one blood pressure measurement of above 130/80, you are required to be medicated by your doctor. And then you are required to take that medication for the rest of your life. So that's an example for me of the real challenges that we face in prevention, because the curative medicine side there's some really, really big voices there that talk in the, with the medication hats on. So I want to kind of leave it at that. Say this, cardiorespiratory fitness is the best thing you can do for your health. It's being physically fit is the very, very best thing you can do for your health, bar none. And it's as simple as that. So thank you for your time. And if there are any questions, I'm happy to take them.
Wow, Steve, as always, thank you so much. I mean, you're just in terms of like your commitment and how seriously you take your, that your whole stance on this is just such and you come across so sincerely. So thank you very much for sharing time with you. And as always, such a privilege. And, as you say, something that I always think about is that it's not just from a health, it's from a mental aspect as well, just how incredibly cardiorespiratory fitness for mental health issues is just so incredibly important, Steve. So, and I know we've had this discussion as well.
Yeah.
So thank you for that.
Maybe I didn't put enough, emphasis on that. So let me make one point quickly, on the mental health side, in terms of programs that we run, and we started this about a decade ago, Dr. Georgie Torres and myself, and we started to work with people that had depression, and we were like, we don't know anything about depression. We call that the socialists, the social sciences. We are on different campuses, so it was quite a challenge for us. But I must tell you that still today, by far, our depression group has been the most successful in reversing, getting off medication. And it makes sense. If you exercise, you feel better. If you wake up in that really black hole of depression and you get to feel better, you're going to do it again. It's not, and so we started finding ourselves in the position where we're saying, because we track people obviously and what they're doing. I just remember Georgie phoning somebody who's walking around a shopping center on a Sunday afternoon, and she's been doing it for like 3.5 hours because it made her feel better. And we're like, just slow down a little bit, so I couldn't agree with you more. So remember that, it is a natural antidepressant. Exercise is the polypill, antihypertensive, anti-cholesterol, antidepressant, you name it. It's one of those pills.
Okay, great, Steve. Well, listen, thank you so much for that. So what we're going to do, we're going to open up the floor to any questions that people might have. You can either pop it in the chat if you have any questions in the chat. And for those of you actually want to go live, you'd be more than welcome to unmute your microphone, put up your hand and ask Steve a question. And just to start off, okay, so just perhaps some clarifications. So Lisa has actually asked a question in the chat, Steve, exercise dose and health conditions. How do we convert that to minutes of exercise or intensity? I don't understand the measurements.
Okay, all right, got you. Okay, so let's first of all talk about the calculation itself. I'll use one that I'm quite familiar with, metabolic syndrome or diabetes, for example. So the calculation is 18.9 kilocalories per kilogram of body weight. So if you want to know how much exercise, take your body weight and multiply it by 18.9. So in my personal capacity, for example, it's 1,964 kilocalories. That's something I happen to just know off the top of my head. So 1,960 kilocalories per week. Okay, so that is volume. All right. So all of your fitness devices will be able to give you energy expenditure of a particular exercise or bout of exercise that you do. We can even these days break it down by exercise. I know how much a set of bench press will expend if you're a male of 75 kilos. So we've got that kind of detail now. So when you start with the amount, 1,960 kilocalories per week, so divide that out by 7 days, that will give you the amount per day. And then the intensity is moderate, 60 to 75% of my maximum heart rate. If I want to do it as vigorous, obviously I can go into the 80s. What happens when I go vigorous is the amount of time that I need to get that expenditure decreases. Does that make sense?
Yes.
So what you do is take 1,960 so all of you want to work that out, take the condition, take your body weight, multiply it out by the number, and that will give you the amount of exercise that you need to do in a week. Now, here's the thing. You can miss 1 week. Your benevolent aunt will give you 1 week off. But if you miss 2 weeks, she says, I told you that you weren't serious, and she pretty much starts over again. So in order to make changes to those conditions, to get your Formula One engine back, I may have spoken that analogy before, it takes about 12 weeks. That's the interesting. So there is a real science behind this 12-week number. So 12 weeks is the amount of time that you need to spend doing this. You can miss by a week, but if you miss 2 weeks, you go back to the beginning. So that's what we do in chronic disease management. If we use physical activity as a medicine. And we have amazing results with just physical activity. When you start adding nutrition, start adding coping, when you start adding gut health, that's when you get real wins. But that's how you use the data to work out volume and intensity. I hope that answers the question.
Yeah, thanks, Steve. So what we'll do is I'll just get that from you and break it down simply, and we can post that to the Facebook group.
Yeah.
To let
I'll
people,
do some real examples.
So they can actually, real examples of how they can actually work out. So for example, if 80 kilograms, then this much is prescribed, etc. And from what I'm hearing, from what you're saying, consistency over a 12-week period is absolutely key.
Vital.
Okay.
But after 12 weeks, she says, I believe you. Cool. You go back to 8.7. So you don't need to stay up at that massive volume. That massive volume is because you got yourself into that position. You need to get yourself out. She doesn't believe you until you've done 12 weeks. But yeah.
Okay, brilliant. Thank you, Steve. Any other? So Lisa's asking again, kilocalories is 1,000 calories. Lisa,
that's correct. Now, it's very important. On the back, when we talk about calories in the popular press, we're talking actually about kilocalories. Okay, so remember, a kilocalorie is how we should be referring to calories. That is why in South Africa we use kilojoules, by the way. So kilocalories kilocalorie is a calorie in the way we speak. If you look on the back of any food and you see the calorie expenditure number, it's in kilocalories, kcal. A calorie is a minute amount. Okay, if you're eating a calorie, you're in big trouble. Yeah. So kilocalorie is the correct way to use it. That's why use kilojoules. It's better. Also, Warren, I'll send you the conversion from kilocalories to kilojoules. It's actually very simple as well.
Yeah, it's always disheartening. You sort of like do like a half-hour hit session on elliptical training. You've only burnt like 3 calories.
Yeah, exactly.
It takes more calories to burn off of each chewing a muffin than it does to spend half an hour on an elliptical trainer.
No, absolutely.
Okay, great. I'm not seeing any other questions from the chat. If there are any other questions, for those of you that re-watch the video and you would like to post questions, please do so, because we'll get them. Lisa, you just raised your hand again. Would you like to go live, Lisa?
I did. It's easier.
Okay, great.
Thanks.
Hello, Lisa. How's it?
So when my Garmin says I've burned so many calories, is that kilocalories?
That's kilocalories.
I don't have to divide by 1,000.
No,
okay.
No.
Just want to get clarity on that because I don't know how you convert. Okay,
Absolutely.
Got it. Thank you.
Yeah, no problem.
Okay, brilliant. Thanks for that, Lisa. It's always nice to see a live person when we do these talks.
That's great.
It's like we're not just talking to like a whole series of thoughts. There's like real people behind that.
Yeah, I'm sitting here.
There's another hand that's come up.
Yep.
There's another hand that's come out.
Hello, how are you?
Hello, Amanda. I'm fine, and you?
I'm good, thanks. I'm just sitting outside. I wanted to ask you, it's the best. I wanted to ask you, I want to get fit enough to run a marathon. So how much do you have to eat? Because I know everyone's like, you have to have a lot of protein and all that. You have to build your muscles, but then also you don't want to get fat. So how do you figure that out?
Okay. All right. First of all, there's, and maybe that's something to deal with. But the great protein myth, okay, there are a few protein myths, the great dairy myth, the great protein myth. Number one, a woman to be healthy and to run a marathon needs 0.6 grams of protein per kilogram of your body weight per day. So that's it. And you can get protein from lots of different places. So that's the first thing. You don't need a lot of protein. When it comes to getting fit, or preparing for a marathon, there there are loads and loads of models to get there. And they're great training sort of pyramids to get there. But you would certainly need, by rule of thumb, to do a marathon looking at double the race volume. So in other words, 80 kilometers in a week at your peak training volumes. So you would need to build up to be able to do at least 80 kilometers of running a week. And you would probably need to do that for 3 or 4 weeks in a row before you get to your actual marathon. You'd never have to do the marathon distance. You just need to make sure you get the volume. So if you need any help to build up that model, we would be very happy to help you, and we can track and coach you through the process. So it's not, but it's important just to follow it. That's one way to get sore real quick. If you don't do that in the right way. So yeah, does that answer?
Yeah, thanks very much.
Pleasure.
Yeah, thanks for that, Steve. I mean, between you and Georgia, people, if you wanted any help with it, any of you that are endurance athletes or athletes of any kind from a strength and endurance training point of view, the health architects with Dr. Georgia Torres and Steve, I've learned everything that I've ever learned from an endurance training point of view from Steve and Dr. Torres. So you'd be in very, very safe hands. Any other questions, people? Anybody else? I see there's one more hand up. Or no, is that the same hand? That was, I think was Amanda. Okay. Still, yeah. All right. From my side, I'm not picking up anything else. Cheryl, from you. So Steve, so thank you so much, Steve. It's amazing to have you with us, and so privileged to have you on our team. And we look forward to spending. And Steve, between Steve and I, we will be updating the exercise programs per week. And adding, so any questions, please just fire away. Happy to answer, happy to engage. And then over to you, Cheryl.
Thanks. Yeah. So, for those of you that came on board in the beginning, and we've got a couple of people that are rejoining us from the previous challenge, and you would have seen a lot of people doing the hashtag movement is life. And I think this is like sort of where it's starting to make a little bit more sense now for all of us. So yeah, Steve, I love listening to your insights. This is the second time I've heard you talk about this, but it just never ceases to amaze me, and it's a really good reminder. So thank you so much for taking the time and sharing that with us.
No, most welcome.
And yeah, guys, we're so blessed. We're so blessed to have this kind of insight and advice and guidance amidst us on the team. So very, very grateful to have you on board, and thank you very much.
Thank you.
Okay, awesome, guys. So that's really it for today. The last thing we have to do is just announce our 2 lucky winners. And this really was random. And I think maybe from next week, we'll actually do the draw in the session so that you can see it's random, just so that you know we're doing the right thing. But the 2 lucky winners today, and I'm not sure if they are on the call, but if they are, they can just give us a little wave or a little reaction of some kind. The first one is Kirsten Morse. Kirsten, are you on the call? Kirsten's on the call. You're on mute, Kirsten.
Kirsten,
well
you're on mute.
Done. You're our first lucky draw winner. So thank you for all your posting, and it helped you. It got you the winning number today. So well done for that. And Lorraine will be in touch with you with your voucher. And then the second person is Emil Null. Is Emil on the call today?
I see Emil, there's a message in the chat that says he's got to run. He's dashed off to another meeting.
Okay, so he missed the end. So we will definitely be in touch with Emil and let him know that he was the other lucky winner. And yeah, keep posting, everyone, because that's how you get into the lucky draw. And we'll just literally be choosing some random people over the next couple of weeks. So enjoy those vouchers. Keep going. Keep hanging in there, sharing your experiences. And even if you have a bad day, it's just, I'm hooking onto something that Steve just said. If you miss a day or you miss a week, it's not going to be the end of the world as long as you don't miss 2. Okay, so I think the important thing is if you do have a bad day or you fall off the wagon for whatever reason, get back on immediately after that. So that's the key, and that's what we're all here to do, is just to help you get back on if you do fall off. But so far, it looks like everybody's staying on really well. So well done with that, and wishing you all the best for the rest of the week, and we will see you on the Facebook group. Thanks everyone.
Everybody. Thank you so much, Cheryl and Lorraine.